Happy Thursday. This beautiful October day we're having. Welcome to another Chamber Check-In episode, and so excited to feature a brand new Chamber member, and it's in the healthcare industry. She's got her own clinic. It is Libelula Primary Care, and I have Dr. Sari Ambert Pompey with us today, and I'm going to bring her on the screen now.
Hello.
Hi, Doctor.
Hi.
Hey, thanks for carving out some time with me today.
Thanks for taking the time.
I got to meet you at our President's Reception for new members last quarter, and I didn't get a chance to talk with you. So this is our time. So this is great. I get it, and then we get to do it live and share your story.
Great.
So I have known of other primary care centers that offer the type of partnership that you offer in the past. So this is kind of unique, and it's kind of industry. It's kind of new to the industry, right? Relatively new, and I think this is really cool for you to share. But these chamber check-ins are really great ways that the chamber can share its members' stories, products, and services, but most importantly, the people. And so, Dr. Sarai, why don't you tell us a little bit about your background and history of work that led you into the healthcare industry?
Absolutely. I was born and raised in Ponce, Puerto Rico. That's where I went to medical school. Unfortunately, there's not a lot of medical residencies there, so I was forced to leave. I ended up in Portland in OHSU doing a brain tumor fellowship research. And after that, I decided to do an internal medicine residency, but only apply to the programs nearby, Boise being one of them. So I completed my internal medicine residency right here in Boise in the VA through the University of Washington. After that, I stayed in the VA for 10 years. And now I have my own independent practice.
Wow. Okay, what a cool story. So you've been in Boise for a while now.
Yes.
Okay. How was that experience at the VA?
Yeah, I really enjoy working in the VA. First of all, learning in the VA, although we rotated in other places like St. Al's, St. Alfonso, St. Luke's, and Terry Riley. But I appreciate there. Veterans are just amazing people, and we don't do enough for them. I really enjoy the mission, and staying there for 10 years, I was able to do primary care to rural areas and also provide gap coverage throughout the Northwest. I was leading the Northwest region in primary care via telehealth. And sometimes we would go also to those places until they got somebody in person to take over. I had medical residents and students learn how to do telehealth as well. And this is pre-pandemic. So when the pandemic came, we already knew what we were doing. So I was able to help out other places to catch them up.
Yeah, that really sprung, right? Telehealth really sprung and just skyrocketed.
Yes, the Ada County Medical Society set up a video meeting so I can go over those soft skills with other providers and physicians throughout the area.
Awesome. Okay, well, you've got quite the background and experience. Now, as an entrepreneur with your own practice, tell us a little bit about that origin story. What made you take that leap of faith?
Yeah, I was interested in the type of care that is called direct primary care. It's been around for over 10 years. There's a lot of good data that shows that the continuity of care through direct primary care has good outcomes, both for patients and for the physician. So I was really interested on transitioning to something like that to have a little bit more say in how I do things with my patients and not necessarily have an administrator limiting or dictating care. So I can really get back to personalized care, listening to patients, giving them enough time to tell me what's going on and follow up with them myself. So whenever anything happens to them, I would know their context of the care and I am able to provide it. This opportunity to develop this type of clinic, it's really a blessing. I was able to go to a summit where they have different types of conferences and teaching how to do this type of care. And I really just learned a whole lot about it. Also, have joined some seminars and other types of teaching and learning from members in the chamber as well. The different chambers that have been very helpful for me to put that entrepreneur hat, business owner. That's a new hat to me. Uh, so I do enjoy having the clinic and having that independence and being able to provide the care that I always wanted to provide.
You mentioned direct primary care, and does that just mean you're an independent doc? Is that what that means?
So direct primary care is a membership-based healthcare model that removes the insurance from the barrier. So that it's the relationship is directly with the patient without an insurance dictating care.
So it's a
Patient,
subscription-based model, basically. I pay a monthly fee and I can get the care that I need.
that is correct. We get to have longer visits if we need to. We dictate the care. We can decide, if I need to see you sooner. I try to set up the clinic so people don't have wait times. And direct communication with me directly. It's just all these additional benefits without an insurance dictating the care. So that's what direct primary care is. It's not health insurance. Those are not the same thing. By itself, it does not meet ACA requirements of having insurance. However, if you combine it with a cost sharing service, that together can meet the criteria for ACA.
Okay. Well, we'll get into that a little bit too, because I have a business question for you that you can share. I want to talk about something really fun. Your logo, Libelula, Libelulu. It took me a little bit of time to try and pronounce that, and so I went and looked it up, and I want you to share what that means.
Yeah. So libélula is dragonfly in Spanish. I definitely wanted some representation of the parts of who I am, and my Latino roots are very strong. So I definitely wanted something in Spanish there, but I left the primary care so people knew what it was. The libélula is Spanish for dragonfly, and my logo in specific has an S in it for Sarai. The dragonfly is a symbol of transformation. So I hope that the care that I provide is transformational for patients. My hope is to empower people to take charge in their health, and I can help and guide them to that.
This is really a great reason to have this broadcast, because I love hearing the real mission and vision behind our members' stories, their brands, and wow, the transformational education right there. I love the dragonfly for that.
Thank you. Yeah,
Okay.
definitely important to me.
Okay, cool. Thanks for explaining that. Your location, where are you? Do you have one clinic? Do you have more clinics? Tell us a little bit about that.
So I have one location, and that is in West Downtown, where it's in 2402 Jefferson Street, in the corner of Jefferson and 24th. It's a shared clinic space with other independent providers. There's a statistician in the same building, and another physician that's family medicine. But I have my own office right here. We have free shared parking for our patients and shared lobby and refreshments for people when they come in if they want water or something like that.
Okay, so I'm going to put your website and scroll it on the bottom of the screen. And it has your address, contact information. And while that's scrolling on the bottom of the screen, for those that don't know what services you provide, what are some of the breadth of care that you're able to provide?
Yeah, so I provide preventive care, what would be called like yearly visits. I still do that. I do chronic disease management, like managing diabetes, high blood pressure, cholesterol, weight management, but also acute issues like a rash or a cut that requires a stitch, or something that needs to be seen right away and may require antibiotics. I also do telehealth. Patients can, through a secure portal, they can send me pictures or text me their concerns, and we can triage it like, oh, okay, I need to see you next Monday, or, oh, don't worry about it, that should be okay. So I can do all those types of services. For small businesses, in addition to that, I can also do in-service if they want, where we can do like a in-service to talk about wellness, reduce burnout, and things like that.
Okay, so I break my arm. Can I come in and see you, or is that?
So it depends. If it's a displaced fracture that requires surgery, that's not me.
Okay.
But if it's just a simple non-displaced fracture, I can help with that.
Okay. Thank you for explaining that to me. You had mentioned the business piece a little bit, and that's why we're here today. So I know that there's a high cost to healthcare, and business owners are always looking for added benefits for their employees. Tell me how you would work with a small business to add your clinic to their benefit portfolio.
Absolutely. So my hope is that I can help the small business, nonprofit, or small team come up with a plan where their employees and their team can have primary care services, telehealth access, but also keep the cost low. And it can be shared, like they can do like a split payment. They can do like a percentage, and then their employee can do a percentage. The employee can also choose to opt out of that. They don't have to feel all of them obligated, but if some of them want to, they can, and they can also opt in to put their family in or not. There's a lot of different ways to do it.
Okay. We all have our docs, right? We all have our healthcare needs met here in the region, and I love to see more independent docs. So thanks for your leap and for starting your clinic here.
Yes, it's very exciting.
And while we kind of come to a close, I don't see any questions from the listeners yet, but while we've been talking, is there anything else that we've missed that you'd like to educate the public on while we have you?
Yeah, one of the things that people can benefit from is that starting January, they can use their health spending accounts to pay for the membership. That just passed in HR1, and it's becomes something that they can do starting January 1st.
Oh, so my HSA can be used to pay for the subscription, to the monthly subscription.
That's right.
Brilliant. Okay. Well, I know that's a huge advantage, huge benefit. Dr. Sarai Amber Pompey, thank you so much for investing in the chamber, congratulations on your relatively new clinic. We wish you the best of luck, and please reach out to us if you need anything at all.
Thank you so much. I appreciate your time.
Absolutely.
And
For those who are listening, please remember to subscribe and like our YouTube channel, and join us next week as we feature the owners of Old Speak Bar. It's going to be really fun. Dr. Sarai, thank you so much. Have a great weekend.
Bye.